Right now, as you're watching this video, there's a 15.8% chance you're experiencing a headache. That means if 100 people clicked on this video, at least 15 of them are in pain right now. But here's what terrifies me as a doctor. Half of the world's population will experience a headache this year. Half. We're talking about 3.1 billion people suffering from one of the most underestimated conditions in medical history. And you know what's even more disturbing? Most of you watching this have no idea what's actually happening inside your skull when that pain strikes. I'm Dr. Michael, and today we're diving deep into something that affects more people than diabetes, asthma, and heart disease combined, yet somehow remains invisible to most healthcare systems. We're talking about headaches and migraines, the third leading cause of disability worldwide. Yes, you heard that right. The third. And by the end of this video, you'll understand why that throbbing pain in your head deserves way more respect than you've been giving it. But before we get into the science, let me tell you something that might blow your mind. Globally, headache disorders affect approximately 40% of the population. That's not a typo. For out of every 10 people you pass on the street are dealing with this. And here's the kicker. Only 40% of people with migraines or tension-type headaches are professionally diagnosed. The rest? They're self-treating with whatever they can find at the pharmacy, often making things worse. So buckle up, because we're about to explore why your brain feels like it's being squeezed in a vice, why some people see flashing lights before the pain hits, and why that harmless painkiller you've been popping like candy might actually be causing more headaches. Trust me, by the time we're done here, you'll never look at headaches the same way again. The epidemic nobody talks about. Let's start with some numbers that should make every government in the world sit up and pay attention. According to the Global Burden of Disease Study, and this is the gold standard of medical research, folks, migraine alone ranks as the second highest cause of disability worldwide. Second, only stroke beats it. And for women under 50, migraine is number one. Let that sink in for a moment. But here's where it gets really interesting. And by interesting, I mean absolutely infuriating. Despite affecting 52% of the global adult population, headache disorders remain massively underrecognized, underdiagnosed, and undertreated. Why? Because headaches don't kill you. They're just headaches, right? Wrong. Let me paint you a picture. In the UK alone, nearly 25 million working or school days are lost each year due to migraines. That's not including tension headaches, cluster headaches, or any other type. Just migraines. Now multiply that across the globe, and you're looking at an economic catastrophe that nobody wants to talk about. The indirect costs, lost productivity, missed work, reduced quality of life, dwarf the direct medical costs by a magnitude that would make your head spin. And yes, that pun was intended. Here's something that keeps me up at night. Headache disorders are episodic. They don't cause death, and they're not contagious. So public health officials and politicians largely ignore them. But tell that to the person who spent 3 days in a dark room, vomiting, unable to move, because even the slightest sound feels like a knife through their skull. Tell them it's not serious. What's actually happening in your head? All right, let's get into the science, and I promise to make this as painless as possible, unlike an actual headache. There are two main categories of headaches, primary and secondary. Primary headaches are the troublemakers. These include tension-type headaches, migraines, and cluster headaches. They're called primary because the headache itself is the condition. It's not a symptom of something else. These bad boys result from inflammation or problems with pain-sensitive structures in your head, blood vessels, nerves, and muscles. Basically, your brain is throwing a temper tantrum, and you're feeling every second of it. Secondary headaches, on the other hand, occur when something else triggers those pain-sensitive areas. This could be anything from a sinus infection to a brain tumor. Though let me immediately calm your anxiety. Brain tumors causing headaches are rare. Much more common culprits include dehydration, medication overuse, we'll get to that nightmare, hangovers, looking at you, weekend warriors, or even something as simple as ice cream. Ever had brain freeze? That's a secondary headache, my friends. Now let's talk about the king of all headaches, migraine. This isn't just a bad headache. It's a neurological disorder that can turn your world upside down. Migraine affects approximately 14% of the global population, with women being hit 3 times harder than men. Why? Hormones. Always the hormones. A migraine typically presents as a throbbing or pulsating pain, usually on one side of the head, though it can spread. But here's what makes migraines truly diabolical. They come with friends: nausea, vomiting, sensitivity to light and sound, and sometimes, and this is where it gets really weird, visual disturbances called auras. Picture this. You're going about your day when suddenly you start seeing zigzagging lines, flashing lights, or blind spots in your vision. Some people describe it as looking through a kaleidoscope. This is the migraine aura, and it happens to about 25 to 30% of migraine sufferers. The aura typically lasts 20 to 60 minutes, and then bam, the headache hits like a freight train. But wait, there's more. Some migraine sufferers experience what's called migraine without aura, and others have migraine with aura but no headache. Yes, you can get all the visual disturbances without the pain. The human body is weird, folks. Tension-type headaches are the most common type, affecting about 26% of the global population. These are the band around your head headaches, dull, aching pain that feels like someone's tightening a vice around your skull. They're usually caused by muscle tension in the head, neck, and shoulders, often triggered by stress, poor posture, or spending too many hours staring at screens. Sound familiar? Then we have cluster headaches, and thank God these are rare because they're absolutely brutal. Nicknamed suicide headaches. Yes, it's that bad. Cluster headaches cause severe pain around one eye, usually with watering of the eye and nasal congestion on the same side. They occur in clusters, hence the name, sometimes multiple times a day for weeks or months, then disappear for months or years. If migraines are a freight train, cluster headaches are a nuclear explosion localized behind your eyeball. The trigger zone. What sets off your headaches? Understanding your triggers is like being a detective in your own medical mystery. And here's the frustrating part. Triggers are different for everyone. What sends me running for a dark room might not bother you at all. Common triggers include stress, the number one culprit. When you're stressed, your muscles tense, your blood vessels constrict, and your brain chemistry goes haywire. It's a perfect storm for headache development. Dietary triggers are fascinating and infuriating in equal measure. Aged cheeses, processed meats, chocolate, alcohol, especially red wine, and foods containing MSG or artificial sweeteners can trigger migraines in susceptible individuals. Caffeine is a double-edged sword. It can both trigger and relieve headaches, depending on your consumption patterns. Hormonal changes, particularly in women, are major triggers. This is why many women experience migraines around their menstrual cycle. Serena Williams, one of the greatest athletes of all time, suffers from menstrual migraines. She's been very open about how it affected her performance, saying, "I know it doesn't look like it affected my tennis, but especially in the sun, playing with a migraine makes it worse." Environmental factors like bright lights, loud noises, strong smells, and weather changes can also trigger headaches. Some people can predict rain better than meteorologists based on their migraine patterns. Sleep issues, both too much and too little, are common triggers. Your brain likes consistency. Mess with your sleep schedule, and it will punish you. Dehydration is the most underrated trigger. Dr. Cynthia Armand from the Montefiore Headache Center calls dehydration the biggest, most potent trigger for migraine. Supermodel Elle Macpherson drinks 3 liters of water daily to prevent her migraines, and when her kids complain of headaches, her response is always the same: drink water. Medications, the good, the bad, and the rebound. Let's talk about treatment, because this is where things get really interesting. For mild to moderate headaches, over-the-counter medications are often the first line of defense. Acetaminophen, Tylenol, is widely used, but, surprisingly, it's one of the least effective options for migraines. In a massive study analyzing over 3 million migraine attacks, acetaminophen was rated helpful only 37% of the time, the lowest score of all medications studied. NSAIDs, nonsteroidal anti-inflammatory drugs, like ibuprofen, naproxen, and aspirin work better. Ibuprofen was rated helpful 42% of the time in that same study. Not spectacular, but better than acetaminophen. The combination of aspirin, acetaminophen, and caffeine, sold as Excedrin migraine, performed better, working about 50% of the time. But the real champions? Triptans. These prescription medications were rated 5 to 6 times more helpful than ibuprofen. Elatriptan topped the charts at 78% effectiveness, followed by zolmitriptan, Zomig, at 74%, and sumatriptan, Imitrex, at 72%. Triptans work by mimicking serotonin and binding to specific receptors in the brain, which constricts blood vessels and blocks pain pathways. They're specifically designed for migraines. They won't help with other types of headaches or pain. And here's the critical part. They work best when taken early, within the first 20 minutes to 2 hours of headache onset. But, and this is a big but, triptans have some important limitations. They can't be used by people with heart disease, uncontrolled high blood pressure, or certain types of migraines, hemiplegic or basilar migraines. They can also cause side effects like chest tightness, dizziness, and drowsiness. And perhaps most importantly, overusing triptans can lead to a nightmare scenario called medication overuse headache. The medication overuse headache trap. Here's where we need to have a serious conversation, because this is a trap that catches thousands of people every year. Medication overuse headache, MOH, also called rebound headache, occurs when you use acute headache medications too frequently. Here's how it works. You get a headache, you take medication, it goes away. Great. But then the headache comes back, so you take more medication. And more. And more. Before you know it, you're taking painkillers almost daily. And here's the cruel twist. The medications themselves start causing the headaches. Butalbital-containing medications and opioids are the worst offenders. But even triptans, NSAIDs, and acetaminophen can cause MOH if used more than 10 to 15 days per month. The guideline is simple. Don't use acute headache medications more than 2 to 3 days per week. Breaking the cycle of MOH is brutal. It often requires stopping all pain medications cold turkey, which can temporarily make headaches worse before they get better. Sometimes hospitalization is needed for severe cases. This is why prevention is so much better than falling into this trap. The natural approach, supplements, and lifestyle. Now, I know many of you prefer natural approaches, and I respect that. The good news is that several supplements have solid scientific evidence supporting their use for migraine prevention. Magnesium is the star player here. Studies show that migraine sufferers often have lower magnesium levels, and supplementation can reduce migraine frequency. The recommended dose is 400 to 600 milligrams daily. But here's the catch. Not all magnesium is created equal. Magnesium oxide is cheaper but can cause diarrhea. Magnesium citrate is better absorbed. Magnesium glycinate is the gentlest on your digestive system and best for sleep quality. Riboflavin, vitamin B2, at 400 milligrams daily has been shown to reduce migraine frequency by 50% or more in about 59% of people who take it for 3 months. The theory is that riboflavin helps fix mitochondrial dysfunction in migraine sufferers' brains. It's well-tolerated, affordable, and safe, even during pregnancy. Coenzyme Q10, CoQ10, works similarly to riboflavin, supporting mitochondrial function. The recommended dose is 150 to 200 milligrams twice daily. Studies show it can reduce migraine frequency in over 60% of users. The combination of magnesium, riboflavin, and CoQ10 has been studied together and shows promising results, particularly when used for at least 3 months. Feverfew, an herbal supplement, has mixed results in studies, but many people swear by it. Butterbur was recommended but is no longer advised due to liver toxicity concerns. This is a perfect example of why natural doesn't always mean safe. Ginger has shown promise both for treating acute migraine attacks and reducing nausea. Some people find it as effective as over-the-counter medications. Melatonin isn't just for sleep. It may help prevent cluster headaches and migraines, particularly those related to disrupted circadian rhythms. Lifestyle modifications, the foundation. Listen, I can prescribe you the best medications in the world, but if your lifestyle is working against you, we're fighting an uphill battle. Sleep hygiene is crucial. Go to bed and wake up at the same time every day. Yes, even on weekends. Ben Affleck, who was hospitalized for a severe migraine while directing Gone Baby Gone, attributed his attack to overwork and lack of sleep. Hydration cannot be overstated. Aim for at least 2 to 3 liters of water daily. Before reaching for medication, try drinking a large glass of water first. You might be surprised. Regular exercise can prevent migraines, but intense exercise can also trigger them in some people. Find your sweet spot. Gentle activities like yoga, tai chi, or swimming are often well tolerated. Stress management through meditation, mindfulness, deep breathing, or therapy can significantly reduce migraine frequency. Studies show that mindfulness meditation can be as effective as daily preventive medication for chronic migraine with medication overuse. Dietary modifications matter. Keep a food diary to identify your personal triggers. The elimination diet, removing common triggers for a few weeks, then reintroducing them one at a time, can be illuminating. When to worry, red flags. Most headaches are benign, but sometimes a headache is a warning sign of something serious. Seek immediate medical attention if you experience thunderclap headache, sudden, severe headache that reaches maximum intensity within seconds to minutes. Headache with fever, stiff neck, confusion, or altered consciousness. Headache after a head injury. New headache in someone over 50. Headache with vision changes, weakness, numbness, or difficulty speaking. The worst headache of your life. Progressive headache that worsens over days or weeks. Headache that changes with position, worse when lying down or standing up. These could indicate serious conditions like hemorrhage, meningitis, brain tumor, or stroke. Don't mess around. Get checked out immediately. Celebrity struggles. You're not alone. If you're struggling with chronic headaches or migraines, you're in good company. Lisa Kudrow from Friends has suffered from migraines since childhood. It runs in her family. Interestingly, her father is a headache specialist who discovered that lidocaine nasal drops can stop migraines in 60% of patients. Serena Williams, arguably the greatest tennis player ever, deals with menstrual migraines and has been very open about the struggle of being taken seriously by doctors who told her to tough it out. Janet Jackson canceled concerts in 2008 due to vestibular migraines, which cause severe vertigo in addition to head pain. Kristen Chenoweth credits Botox injections with virtually eliminating her chronic migraines. Botox is FDA approved for people with 15 or more migraine days per month and can reduce headache frequency by up to 50%. Even historical figures suffered. Thomas Jefferson experienced what's called status migrainous, migraine attacks lasting weeks at a time. Julius Caesar, Napoleon, Vincent van Gogh, and Lewis Carroll, whose Alice in Wonderland may have been inspired by migraine auras, all dealt with this condition. The bottom line. Here's what I need you to understand. Headaches and migraines are real medical conditions that deserve proper diagnosis and treatment. They're not all in your head. Well, technically they are, but you know what I mean. They're not character weaknesses. They're not something you should just push through. If you're experiencing frequent headaches, more than twice a week, see a doctor. Keep a headache diary tracking frequency, severity, triggers, and what helps. This information is gold for diagnosis and treatment planning. For acute treatment, early intervention is key. Don't wait until the pain is unbearable. Take your medication at the first sign of headache. For prevention, consider the triple threat: magnesium, riboflavin, and CoQ10, along with lifestyle modifications. Give any preventive strategy at least 3 months before deciding if it works. Avoid the medication overuse trap. If you're taking acute medications more than 2 to 3 days per week, talk to your doctor about preventive options. And remember, you're not alone in this. With 3.1 billion people affected worldwide, headaches are one of humanity's most common struggles. The good news? We have more treatment options now than ever before, and research is ongoing. Take your headache seriously. Your brain is literally screaming for attention. It's time we all started listening. I'm Dr. Michael, and I hope this video has given you the knowledge to take control of your headaches instead of letting them control you. If you found this helpful, hit that like button, subscribe for more medical content that actually makes sense, and drop a comment letting me know about your experiences with headaches. What works for you? What doesn't? Let's learn from each other. Stay healthy, stay informed, and remember, your pain is valid, and help is available. See you in the next video.